Heart sounds. The heart is the main organ of the body's cardiovascular system, which is comprised of a network of blood vessels that pumps blood throughout your body. As the heart pumps blood throughout the body, the valves in the heart are parts of your heart that open and close to let blood flow from one area of your heart to another. They help ensure that blood moves at the right time and in the correct direction. Heart sounds are created from blood flowing through the heart chambers as the cardiac valves open and close during the cardiac cycle. The four valves that help the heart move in the correct direction are tricuspid, mitral, pulmonary, and aortic. One common form of heart valve disease is where the valves don't open or close properly, causing restriction in blood flow. Stenosis is when the valve flaps become stiff and do not close properly, reducing blood flow and straining the heart. Regurgitation is when the valves are leaky and are unable to close properly, which can cause blood to flow backwards through your valve. Auscultation of the heart sounds with a stethoscope is a cornerstone of physical medical exams and a valuable first-line tool to evaluate a patient. Simultaneously palpate the carotid pulse to help determine the first heart sound. Aortic valve, second intercostal space at the right sternal edge. Pulmonary valve, second intercostal space at the left sternal edge. Tricuspid valve, fourth or fifth intercostal space. Mitral valve, fifth intercostal space in the midclavicular line. Repeat auscultation across the four valves with the bell of the stethoscope. The familial abdub sound of the heartbeat is caused by the rhythmic closing of the heart valves as blood is pumped in and out of the chambers. S3 is usually a result of volume overload potentially caused by heart failure, regurgitation lesions, and dilated cardiomyopathy. It can also be seen in healthy people. S4 is most commonly pathologic in nature, usually a result from pressure overload. It is frequently present in patients with systemic hypertension, aortic stenosis, or hypertrophic cardiomyopathy. Systolic murmurs can be caused by aortic and pulmonary valve stenosis or mitral and tricuspid valve regurgitation. Diastolic murmurs are usually caused by aortic or pulmonary valve regurgitation or mitral or tricuspid valve stenosis. If you hear a murmur, note sight heard loudest, pulse timing, character, volume, and radiation.